Hair transplants are not permanent. Surprised? Let's talk about why and what you can do about it. Many people believe that once you have done a hair transplant, the job is done forever. But that's not true. Hair is a living tissue, changes with age, lifestyle, health, and even stress. So, yes, even transplanted hair can thin or fall after some years. And when that happens, people feel frustrated, thinking their effort or money went to waste. Hi, I'm Dr. Prateek Sondhi from Regrow by Derma Circles. Every day, I meet patients who ask me, Doctor, once I get a transplant, will I never lose hair again? Here's the reality. A hair transplant is not a forever guarantee. It is powerful long-term investment in how you look and how you feel. But just like any investment, it needs maintenance, care, and sometimes even reinforcement. Now back to the point. Why does this happen? Genetics may still affect your hair roots. Health conditions like thyroid issues or even vitamin deficiencies can weaken your hair. Neglecting aftercare or not following the instructions given to you can also make a difference. So while the transplant gives you new, natural looking hair, it isn't a magic forever fix. It is an investment, and like any investment, it needs care. This is exactly why at Regrow by Derma Circles, we don't stop at surgery. We prepare you for the future too. Here's how. First, we provide coverage for years ahead. So if hair from your transplanted area falls again, we restore it. Second is supportive treatments like PRP. These strengthen the transplanted roots and keep them healthy. Third, regular follow-up so we can catch any problem early before it becomes big. This way, patients don't have to stress about the what if. They know we will stand by them for years. So yes, hair transplant is not permanent, but that doesn't mean that you should be afraid of it. It means you should choose a clinic that not only gives you the results on day one, but also protect those results in the future. At Regrow by Derma Circles, we look at it as a long-term journey, an investment in your appearance and confidence. And our job is to make sure that investment remains safe. Confidence isn't about today alone, it is about tomorrow too. And we are here to make sure you're covered for both.
Hi doctor, can we have a FAQ round with you for hair transplant?
Sure.
Is a hair transplant permanent?
The results of a hair transplant are long-standing, but we cannot claim that they are permanent.
So does a hair transplant look fake?
If done well by a qualified hair transplant surgeon, the results of a hair transplant are absolutely indetectable.
Is a hair transplant painful?
So after anesthesia, most patients feel no pain.
Will I have visible scars post hair transplant?
So again, if a FUE surgery is done well, there are no visible scars.
Can women also get the hair transplant done?
Yes. If women have an adequate donor area, they can also undergo for a transplant. Women can undergo hair transplant in two scenarios. If their forehead is large, they can go for a forehead lowering surgery, or if they have diffuse thinning of the hair, they can go for a hair filling.
Why do hair transplant hair fall after few years?
There might be many reasons for that. One reason is genetics, another is hormonal disbalance, the third can be poor aftercare of the surgery, four can be smoking. These are some of the issues which can reduce the longevity of transplanted hair.
What happens if my hair transplant hair falls again?
So in most cases, the results of hair transplant are very long standing. However, if there is loss of the hair in the transplanted area, we provide you with a no questions asked touch-up.
How can I make my transplant last longer?
So you can have good healthy diet, follow the instructions given by your doctor, take the medicines which your doctor has prescribed you, also do regular PRP sessions. They can help to improve the result of your transplanted hair.
Do I need PRPs after hair transplant?
We do recommend PRP sessions after a hair transplant. We recommend them at 3 monthly intervals. They help to provide the growth factors which are essential for hair growth.
Can I avoid touch-up completely?
Yes, of course. Most patients do not require touch-ups because the results are satisfying. If in any case you are not satisfied with the result of your surgery, then a person can opt for a touch-up.
And who will perform my surgery?
So it's a team process. There are about 7 to 8 people involved in the team, which has doctors and the trained technicians.
How soon can I return back to my work after the hair transplant?
That depends on the kind of work you do. If you have an office-based work, you can join as early as day 3 of the surgery. However, if your job involves going to places which are dusty or you have to do physical exertion which makes you sweat, then after 10 days you can join any kind of work.
What makes Regrow different from other clinics?
What makes us different is that we are fully committed to providing a good result of a hair transplant, and also we are the only clinic who's guaranteeing that if you're not satisfied with the results, we provide a no questions asked touch-up.
Are there hidden costs later after the hair transplant?
So the hair transplant surgery involves the investigations, the surgery, the head wash at day 3, the head wash at day 10. We also provide PRP sessions depending on the plan that you choose. So these things are all included in the cost of the surgery.
Do I need to visit the clinic often after the hair transplant done?
So the only mandatory visit is at the day 3 when we remove the dressing and teach you how to wash your hair. All the other sessions are recommended. They are not compulsory.
Can gym or workouts cause hair transplanted hair to fall again?
No. So the only precautions that you need to take are during the first 10 days of the surgery. After that, you can do all activities including going to the gym.
Does stress affect transplanted hair?
So stress does not have any direct correlation with the transplanted hair because hair transplant is a stem cell therapy. We are transplanting the stem cells and they do not get affected by stress.
Can diet really make a difference?
Diet has a marginal role to play. They can affect the quality of the hair. However, they do not affect the result of a hair transplant.
Which is better, medicines or transplant?
So it depends on what stage of hair loss you are. If you are in the early stages of hair loss, medicines are sufficient. However, if you have had an advanced hair loss and there is significant area of balding, then you must need to go in a hair transplant. After the hair transplant, if you do the medication, that can improve the longevity of the hair.
What age is better for the hair transplant?
So age is no bar. As long as the hair loss is stable, a person can go for a transplant. The second thing is that person should be healthy and without any comorbidities. So if a person is not diabetic, not hypertensive, then at any age a person can be a candidate for hair transplant.
Thank you so much, doctor, for replying all our queries.
Right. Thank you.